Hello, I am Christine, and today I will be talking about stochastic effects. Stochastic effect is the effect of ionizing radiation that occur by chance and which may occur without a threshold level of dose, whose probability is proportional to the dose and whose severity is independent of the dose. So here we can see the characteristics of stochastic effect. The first one is no threshold dose, which means there is no threshold dose in which it can be guaranteed that the stochastic effect will not occur. In other words, stochastic effect is either all or none, which means the person either has the condition or does not have the condition. There is no threshold dose. Second, probability is proportional to the dose. This means that the higher the dose is given to the patient, the higher the probability for the stochastic effect to occur. The third is, severity is independent of the dose. This means that even though the dose is high, it does not necessarily mean that the severity will also be high. So now we look at the examples of stochastic effect. The first one is cancer, which is the most significant risk from exposure to ionizing radiation. Besides that, ionizing radiation has also been known to cause heritable mutations in cells, which will cause genetic effects. There are also non-cancer examples such as stroke, heart disease, digestive disease, and respiratory disease. So, how do we minimize the occurrence of stochastic effect? So this is where the role of radiation protection comes in. The aim of radiation protection is to prevent harmful deterministic effects and to limit the occurrence of stochastic effect. The present system of radiation protection is based on these three important principles. The first one is, all exposures must be kept as low as reasonably achievable. Next, no practice shall be adopted unless its introduction introduces a net positive benefit towards the patient, which means no exposure shall be given to the patient unless the advantages exceeds the disadvantages. The third one is, the dose to individuals shall not exceed the limit recommended for appropriate circumstances. So there is a limit in which it must not be exceeded to give the treatment to the patient. So these principles are very important in order to limit the occurrence of stochastic effects. So that is all from me. Thank you.